Hey, good morning, everyone. Thanks, Kara, and it's certainly good to be with you. And yeah, as Kara just alluded to, and Phil Garner had commented on, we've certainly had a big week inside DIDD and TennCare. A lot of good news, hopefully, on the way for families as it relates to the Katie Beckett waiver. So we're really excited about that. I know that there's a lot of good energy behind that, and there should be. It's a big program, and as Kara said, we've got some folks on here to talk about that. Again, thank you for the questions that you submitted. Please make sure that you do utilize that chat box. If you do have questions that pop up as we're having discussions this morning, we certainly want to know about them. But in the interest of time, I want to go ahead and jump right in and let Kara help lead the discussion. So thanks to everyone that's joined. I can see that we're approaching 500 participants again, which is always good to have a good number, good turnout. Helps us with the communication and letting folks answer some questions. So with that being said, I will turn it back over to Kara. Thanks, everyone.
Thanks. And as you mentioned, we are going to have a conversation about the Katie Beckett program today. And also, I want to make two housekeeping notes really quickly. First of all, next Wednesday is Veterans Day. That is a holiday, and we will not be having office hours next week. So we hope you'll join us again in 2 weeks for office hours. Hope you will miss us in our absence, but also enjoy the holiday and the day that's dedicated to service of those who fought for our country. Other things I want to make mention of is that the time to present comments on IDD integration, that is the deadline is November 13th. So if you have not done so, please make sure to provide comments on IDD integration. And finally, I want to make mention that after we are finished with office hours, we are going to keep this WebEx open, and we have Tanya Copeland with United Healthcare and Charla Long with us, and they will be giving a short presentation on the DSP apprenticeship program. So that will come at the conclusion of office hours. We hope you'll stay with us during that. But we are going to jump in the way we always jump in and start with the questions that have been submitted firsthand, and then we'll talk about the Katie Beckett program. So first question is, with the holidays approaching, does the department have guidance for providers handling visits? I'm going to turn it over to Dr. Davis to give us some insight into that.
So thank you, Kara. Everybody, I think, is aware that under Appendix K, agencies have wide authority in determining their visitation policies. I encourage you to use CDC, Centers for Disease Control guidance in developing those policies. As it relates to visitation, I'm sure many will choose to have a policy that allows the visitation with their families during the holidays. I actually encourage this only under circumstances where it is really important to do so. And so what we have decided within our department is that we're going to assess that based on a clinical need. But there is the concern that people will have that, sort of a risk benefit that has to be looked at with respect to mental health responses to not being able to have that family time that need to be considered in this. If people do leave your facility, I recommend you have a policy for them returning. And so in that policy, what it might look like is this would be an example of that, essentially, that a person would return and be under isolation conditions for a period of time, maybe 5 days after return, after which they would be tested. And if the person has a negative test at that point, you could remove the isolation. Obviously, if they're positive at that point, you're going to follow the procedures for addressing a case of positive COVID-19. So that essentially is the way I would break down the response to developing a policy surrounding visits during the holidays. Obviously, you're going to be under a lot of pressure to do that at varying points, and you need to be clear on what your expectations are going to be for people. Thank you, Kara.
All right, thank you very much, Dr. Davis. Stay on the line because our next question is also going to be for you. Our pharmacy has asked if we want to provide COVID vaccines for our individual. To best answer him, I would like to know if DIDD plans to have another way to distribute them to agencies for our individuals, possibly sooner than a typical pharmacy. And I believe that you're going to want to share a screen when you discuss this, so we'll get that. We'll give you that ability in just a second. Dr. Davis. Dr. Davis, you're on mute.
Yes, I'm here, Kara. I'm just trying to work it out so I can share my screen now. Hold on just a second. Yeah, right there it is. Okay. Am I sharing?
Yep, we gotcha.
Okay. So I just want everybody to be aware, and I will paste this link to the COVID vaccination plan into the chat box for people. But this is, I just want to make people aware, this is on the Department of Health website and is available for review by anyone. It's still labeled in draft form on there, but this is the current thinking on where we're going with this. So I encourage you to go and read that plan in its entirety. With respect to the question that's being asked right now, I want to direct you to page 17, or actually this is page 18, but page 17 starts with section 7, vaccine allocation, ordering, distribution, and inventory management. And if you scroll down to page 18, at the end of the first paragraph there, it says, during this early phase of vaccine distribution, local pharmacies will continue to be onboarded in anticipation of the need to vaccinate expanded numbers of individuals in phases 1B and 1C. As I've stated earlier, our population, staff, and residents are identified as priority in phase 1C of the vaccine distribution plan. And so you would want to communicate that to your pharmacy in making those arrangements. But I do encourage you, to the extent that you're able, to go ahead and start making those arrangements and getting your name on their priority list, letting them know that people with intellectual developmental disabilities and their staff are prioritized at phase 1C. Kara?
Thank you very much, Dr. Davis. The next question is going to be for Deputy Commissioner Jordan Allen. With the integration of services and the one rate, will PA services be included in that? Since they are capped now on the amount of hours and units they can receive a month, will it remain that way and just so many days, not units per month? Jordan, do you have some insight into this?
Yeah, I do. Thank you, and good morning, everybody. So I think the concept or the hope or the thought is, I mean, first and foremost, again, like we've said over and over, this stuff is still in development. While we've started some conversation with the network through the Partners in Innovation Group, and some of that conversation will continue into the Strategic Leadership Group meeting, the first of which I think is scheduled for this afternoon. The concept would be, or one of the approaches we're thinking about, is a single rate for direct service, and that would include PA, residential day, any direct service orientation, so a DSP and direct service of somebody supported. I don't think that we're contemplating, and again, unless it's introduced by a stakeholder or a provider in one of the work groups, I don't think we're thinking about changing benefit limits, for instance, on a per month basis or a per year basis. Certainly, we're not contemplating any change like that would take effect before 7/1 of next year. Whether or not we think or get to defining different benefit limits in the single system design that will take place thereafter, that hasn't been introduced yet. So right now, there's been no discussion about changing PA benefit limits. I would anticipate certainly between now and 7/1, and then even after 7/1, for PA benefits to remain the same. The continued discussion about a single direct service rate, I think, will be a theme and a component of the ongoing discussions about single system design.
So much, Jordan. Okay, our next question is going to be for Teresa Sloan, our Assistant Commissioner and General Counsel. When are providers required to begin submitting background checks for employees? Is it 90 days from the expiration of Executive Order 63? If so, what is the exact date? And what does that mean for employees whose backgrounds were submitted within the 90 days, but their background or exemption is pending after the 90 days? Are they eligible to work? Teresa, you want to take this? And I can reread any part since it's a multi-question question if need be.
Thank you, Kara. The 90 days began at the expiration of the executive order that provided for that waiver. That was on September 30th. So that's 90 days from that date. And providers only need to submit for the background check. If the background check's not back by then, that is fine, as long as there's documentation that they submitted for a background check through either the TBI or private investigation company. And just as folks were allowed to work as we waited for the waiver, when we had the waiver, as people were allowed to work while we waited for background checks, they are still allowed to work during the period in which we are waiting for the background check to come back. Kara, I think I got them all, but I may not have.
I think you covered it. Thank you very much, Teresa.
Thanks, Kara.
Those are all the questions we had submitted ahead of time. So now we really do want to spend some time discussing with you all the approval of the Katie Beckett program by CMS and next steps. To join us on this and discuss this is going to be our person who is all things Katie Beckett, along with all things, many other things as well, but all things Katie Beckett is a part of his job. Bo Hickman. Bo, I know you have a couple of things you want to discuss about this, including provider enrollment for Katie Beckett. So I'm going to turn it over to you.
Hi, good morning, everyone. And as Commissioner Turner had indicated, this is really a good day in Tennessee after 2020, the way it's been. Looking forward to a program built of, by, and for Tennesseans. And so we're happy to bring this to you with your support. In terms of some questions I'm hearing around provider setup, right now, TennCare is putting a drop-down box in PDMS for providers. And once that's in there, our Office of Business Services will set up a referral. And you guys can go in there if you're interested in providing services, go in there and register on that referral. That's probably the easiest way to do it. And really, it's going to be seamless in terms of adding you as a provider right now. If you're out there and you're a new provider interested, then we're going to follow the same process we have now for provider applications. However, that said, we are going to allow anyone to apply to be a provider and not have open enrollment periods for this program. We're going to allow people to come and provide or apply at the time they want to. Kara, go ahead.
All right, thanks, Bo. Sorry, I was just one couple of things that I wanted just to let folks know, and I'm going to be sharing. Turn my web browser. So we do have, hopefully all can see this. We do have a Katie Beckett page on our DIDD website. It has been updated to reflect the newest information that we have. You'll see some of the information about the registration date on the 23rd. In addition, we have an updated program information sheet, and we are sending an interest list notification letter to everyone who is currently on the interest list. Those have been dropped in the mail, so they should be coming to folks on the interest list within the next few days. We will also be emailing it to them as backup, and as you can see, we've also put it here on our website as well. We did notify the public via press release joint with TennCare on Monday afternoon, and we will be utilizing our social media pages and the email addresses we've collected from folks in the interest list to, one, have direct communication with those families who have expressed interest in the program, and two, to keep everyone else aware and to provide public awareness about the program as we move forward to a November 23rd implementation date. So that is what I've got here. We will be sharing other program updates and hopefully scheduling a presentation on the books shortly. So while I was looking for that, Phil or Bo, if you're on the line, did you answer the question about has DIDD completed hiring for Katie Beckett case managers, or do we need to have Bruce Wilson discuss that?
I'm happy to do that. Thank you, Kara. So right now we have hired 30 Katie Beckett case managers, and they're in place right now, finishing up last-minute preparations for the program to begin. As we move into this program, we have to be cautious and we have to be mindful and well planned in terms of how we hire moving forward. We expect a lot of referrals on the front end. Right now, as of today, there's 747 people on the interest list alone. And personally, we don't feel like this captures the amount of applicants we'll have on day one. And so we've had to stage our hiring around the program. We will be moving forward with hiring additional staff once we see the applicant pool and make some decisions about that.
Okay, thank you very much, Bo, for that information. And somebody asked in the chat if I could share the link to the Katie Beckett page. I have done that in the chat, so feel free to take a look if you would like more information. Okay, going back to questions in the chat. Are providers required to use the system chosen by DIDD, like TheraApp, or will TheraApp work with providers to interface with their platforms? I'm going to turn this question over to Jordan Allen.
Thanks, Kara, and it's a good question, and so I guess I'll address it in two levels. First and foremost, the concept, the approach or the intent to try to identify whether that means build and develop internally or locate and secure an existing platform and then contract with that platform. The idea and the intent in alignment with trying to get to the easiest single system approach across all HCBS services would be to find a program that allows provider agencies to enter their data, have access to their data across all different service platform categories. So, you know, in a perfect world, being completely transparent, if there was a system or if we could develop a system that was made available to providers for their data input needs, and that can be program data, anything from collection of outcome data from ISPs to reportable incident data, EVV data, billing data. If we could find a system that would allow for one single approach, one single platform, one single look and interface across the entire system for all of us to have access to and share data, that would be a perfect approach. How that platform, again, if it exists or if we could build it, how that platform then speaks with or interfaces with providers' individual electronic record or data platforms that they're utilizing, I think is a discussion we would have to have after we have a viable single system option. At this point, you know, as we talked about last week and the week before, what we're doing is vetting available options across the system. And we've had system suggestions sent to us from the managed care organizations, from individual provider agencies, even had one sent to us from a stakeholder who's not currently in our system, but has been following Tennessee and is interested perhaps in jumping into the network here. So we're vetting all possibilities at the point at which we're nailed down on whether or not we're going to secure a contract for a specific program or platform, or we're going to have to build that internally. Then I think we have to start to have discussions about interfaces after that. But that's definitely a second layer discussion. Right now, we're really deep in the exploratory phase.
Excellent. Thank you very much for providing that insight, Jordan. We did get another question from about the Katie Beckett. If you are already a provider for DIDD and or TennCare, will you need to still fill out to provide services for Katie Beckett? Can you, Bo, can you go through this quickly?
Kara, yeah, this is Bo again. So essentially what I was saying earlier is once a referral is set up, we will let you know if you're a current provider so you can then go in and complete that referral in PDMS. That's TennCare's provider network system. Does that answer your question?
I think it does. The question was sent privately, so if the person could put everyone and ask if that helps in chat, that would be fantastic. And I am not seeing any other questions in the chat box. So I will pause for just a second to see whether or not we get any other questions in. And we did. And yes, that answered the question. Somebody wants to know, as long as the person supported is agreeable, is it accepted to lessen our restrictions on running personal errands? We have staff working so much overtime that they have little downtime. Jordan, do you want to discuss this?
Yeah, I can try. I might need a little bit of clarification. It looks like Demarius asked the question. If what you're asking is it okay for people supported to make the choice to engage in community activities, whether those be errands or visiting friends or engaging in any activity that they're choosing in the community, despite the fact that we have differing conditions related to the pandemic across the state? And the answer is now and always has been yes. People should be equipped or being equipped to make those kind of individual choices in an informed way. If what you're asking is it okay for staff people, while supporting someone, to bring that person along or to engage in their own personal errands while in service of the person supported, I think that's the answer to that question is no. We're not, people supported need to be making the choices about what services and how they receive the services that they've requested. And part of that process is not in agreeing to participate in personal errands of the staff person supported. So if I missed the intent of the question, please clarify and I'll try to get closer to an answer for you.
Okay, great. Thank you very much, Jordan. I see a question about updates about the buyout. Since that's an employee-specific question, we'll save that for DIDD interaction with our employees as opposed to a provider forums, just so that we can focus on the questions that are now coming in pretty rapidly. I will mention, though, that our budget hearing is next week on November 12th. We will put the link once we get it out in a special edition of Open Line or Open Line this week if we have that link available. It's at 9:30, I believe. So Andy, correct me if I'm wrong on that time. I will move to the next question, which is there an update on COVID-19 hospitalizations and deaths for individuals served? Teresa, do you want to take this question?
I do. Thank you, Kara. And I think Debbie asked that question. Debbie, we put daily on our website the information on the COVID page. Kara's folks update that, which has the current total number of deaths. We don't track hospitalizations out separately when we're looking at that data. A lot of our folks go to the hospital for other purposes and wind up being tested for COVID while they're there. And the COVID really wasn't related to the hospitalization because they were asymptomatic. So those numbers could be a little bit skewed, and so we don't individually track that information. We can pull it if we need to, but then it's going to be a deeper look at to make sure we really have the accurate information, and we're pulling out folks that may not have been hospitalized for COVID, but were just tested while they were hospitalized for something else and tested positive. Kara?
Thanks a lot, Teresa. Can the Everly Well test be used for ECF and choices, individual and staff? Dr. Davis, do you want to answer this question?
Yes, I do. Thank you, Kara. Yes, these tests are established for use by anyone who is either in any of the waivers that we operate. So the ECF choices waiver, the DIDD 1915C waivers, statewide waivers, all of the waivers that we operate, those tests are available. You just order them through the TEMA website through the procedures that have been established. If you need any additional information about how to order that, then please get in touch with me and I'll help you with that. But yes, those tests are available to you. Carol?
Okay, so I'm going to circle back. I missed a question. When will the department release the process for professional support services licenses needed for RN delegation waiver? Teresa or Dr. Davis, do you want to answer that question?
This is Teresa. I can answer, and if Dr. Davis wants to add, he's more than welcome. Melanie, as you know, we met, or DIDD did meet with the Department of Health to kind of walk through what that process would look like. And I think we've nailed it down at this point. So clinical services, it should be finishing up drafting what that process should look like and getting it out very, very shortly. Thanks, Kara.
Thank you very much, Teresa. Before we call it a meeting and pivot over to the presentation for the DSP apprenticeship program, I wanted to have Jordan share something with you all that he shared with us shortly, because I think it's important and I think it shows the impact that we're making across here in Tennessee. So I will turn it over to Jordan to share that information with you all, and then we'll move forward. Jordan.
Thanks, Kara, and I appreciate the quick opportunity. So most of you, I'm sure, were on the call last week where we got to hear from Jennifer Anderson and Susan Arwood of Emory Valley Center and Core Services, respectively, talk about their direct experiences in the technology pilot program, and then also their visit to the Charles Lee organization. As we've been on this call, I get an update at least weekly, sometimes more. But between last week's meeting and this week's meeting, we have risen to up to 22% of our current provider population. These are provider agencies that serve people in both a residential and day service capacity that are now utilizing and exploring the use of technology across their own individual caseloads. For context, the fact that over 20% of our provider network is engaging in these supports is well ahead, certainly, of any national average, and in fact surpasses even the few other states that are helping to lead the technology initiative. And so I felt like that bared repeating. Certainly want to congratulate the network on forward thinking, want to congratulate Jennifer and Susan again, and the other provider agencies that are very actively engaging in our effort right now, RHA being one that I think also has visited the Charles Lee Center here recently, and many others. I find it overwhelming that the network is adopting this and thinking in such an aggressive and progressive way about supports that they can offer those they serve that allow them to truly achieve the level of independence that they've indicated they desire. So good statistics and something I wanted to share with the group.
Great. Thank you very much, Jordan. Okay, so we are now done with the office hours portion of this call. Commissioner Turner did have to step away for another phone call, so he will not be able to see us all out today. So you're just going to be stuck with me. Thank you all very much for joining us today. We would ask if you would like to stay on the phone, and we will have that presentation from both Tanya Copeland and Charla Long about the DSP apprenticeship program. But the office hours portion of the call is over. So have a great Wednesday, and reminder, no call next week because it is Veterans Day. So with that, I am going to turn it over now to Tanya and Charla to get started on their presentation.
Thank you, Kara. Can you hear me?
Yes, I can.
Yes, ma'am.
All right, perfect. All right. Hey, Charla. So, Kara, did you turn it over to me to be presenter? Or were you going to show the PowerPoint?
Your presenter, Tanya.
All right. Thank you, Charlie. Let me get that up here. Just a second. Let me stop that for just a second. Let me get the other one up. Can you guys see the screen here?
Ma'am.
All right, thank you. All right, thank you guys for letting us join you to present on this very exciting new opportunity that has come full circle for us after several months of working with the Tennessee Department of Labor. Again, I'm Tanya Copeland. I know many of you on the phone. Hate that I can't see faces, but look forward to the day when we're back in person. I currently work for United Healthcare. I'm Vice President of IDD Services. And then with me, I have Dr. Charla Long, who is with Go Long Consulting and with the Quilts Institute. And what we want to do today is really just do an introduction to the Tennessee Direct Support Professional Apprenticeship. There will be lots of questions and lots of other information that you all will want. At the end of the presentation, you're going to get contact information with the Quilts Institute, where you can contact them and be able to deep dive into that information. But we really wanted to take today as an opportunity to do an introduction. Let me say that I know many of you on the phone are providers who have been experiencing the struggles of hiring direct support professionals for many years. We at United Healthcare, as well as TennCare and the other health plans, are actively working daily trying to help or partner with you all to identify ways to address that struggle. This being just one of those opportunities. The Direct Support Professional Apprenticeship Program came as a culmination of work that began with the Tennessee Department of Labor. And by chance, they work with also the U.S. Department of Labor. So we are very excited about this opportunity. The approval was just received in September. And so we want to present this to you all as an opportunity for you all to engage and to identify ways to gain additional employees and work with them to gain additional skills. The Apprenticeship Solution, I know a lot on the phone may not recognize what this apprenticeship opportunity presents. So really what I wanted to do is take just a few minutes to talk about the Apprenticeship Solution and what it means. It's specialized training. There are specialized training and employment programs that offer structured, supervised, and on-the-job learning and self-paced online training to develop new skills. It's an actual registered apprenticeship with the U.S. Department of Labor, which provides a nationally recognized job credential for those who complete this program. And you will see here in the slide, and we're happy to share the deck as well, with some of the structure of the apprenticeship program. One of the things that's not on this slide that is really important to this work as we got this apprenticeship program approved is the work to professionalize the DSP profession. That work and this apprenticeship in particular is helping to move that work along on the national level. So we're really excited about that opportunity as well. When you think about apprenticeships, apprenticeships are something that have long been used by many other industries. We have not used the apprenticeship process for the direct support professionals. Looking at this, they're financially beneficial, so that's one of the reasons we know that many other industries use the apprenticeship model. Looking at the return on investment, you've got that on average employers realize a return on investment of $1.47. But what I'm going to skip to is that last bullet there, that 91% retention. That is something that I know, as being a former provider, is a percentage that I would have loved to have had as I worked with direct support professionals. Apprenticeships experience lower turnover rates. 91% of those apprentices that complete the program are still employed 9 months later. So that's a tremendous benefit when we think about it for our provider agencies. I'm going to focus here on what is my left side, the benefits of apprenticeship for the employers. We, of course, have many benefits for the apprentices as well, but I'm just going to focus in the interest of time on the side where we talk about for the employers. One, when we think about that increased talent pipeline, with the training, both the educational component and the many hours of the on-the-job learning that they are able to experience, we see that talent pipeline increase. When we think about recruitment costs, we see the decreased recruitment costs. And when you think about decreased recruitment costs, we also look at that reduced cost of training expenses when you think about this apprenticeship program. the access to that industry-leading competency-based program, which Charlotte will talk about just a little bit with quilts. And then really thinking about how we're developing out our skilled workforce that improves job satisfaction and outcomes for people supported and their families. And as we think about this IDD integration and some of the outcomes that we're going to be looking for as we move forward with the integration, I think this is a great time to look at the apprenticeship for employers. I'm actually going to turn it over now to Dr. Charlotte Long, and she's going to talk about that partnership and just go just a little deeper into the actual apprenticeship and provide for you contact information after the presentation. Dr. Long?
Yeah, thank you so much. It's great to be with you all today and to present this opportunity to you. We actually have an immediate opportunity because we have funding to help provide for the cost of this training for the first 20 apprentices that sign up. So a great opportunity we really want to make you aware of in case you have folks that might be interested in this type of an opportunity. So you heard Tanya talk about kind of how an apprenticeship works. It really is a public, a nonprofit, a private partnership. All these entities coming together to say, what do we do to help Tennesseans that are either out of work or are underemployed? How do we get them into positions where positions and opportunities where we have a lot of need. So the Department of Labor and Workforce Development here in Tennessee had been in conversations with United and with Quilts really ahead of the COVID crisis, but those conversations certainly picked up as we began to think about how do we take folks, for example, from the hospitality industry that hasn't bounced back so quickly. How do we say, you have a gift for serving, what could we do to equip you and help move you into this DSP role? What could we do to help folks that are in the DSP role also feel more comfortable about their skill set? So this is both for current workers you have, it is also for new DSPs. So you can use an apprenticeship model for both of those. But this really is not the Department of Labor and Workforce Development's program. It's not ours. It's not United's. It's actually yours. It is really driven by the providers who sign up. And so our job at the Quilts Institute is to help process paperwork to make sure that we stay compliant with the federal regulations. And really from there, your job is to make sure these folks get the work hours they need to provide them with that kind of support. So if you want to go to the next slide. Thank you, Tanya. Our apprenticeships, as the sponsor, again, as I was just saying, we really take care of all the paperwork. Primarily, we're doing the federal and state compliance. There'll be information that an employer has to provide us because obviously we're not paying the individual. So there's some information that'll have to be exchanged between us, but we can take care of a lot of the federal reporting requirements. And then really as a nonprofit organization, we're not here to make money off of it, but here to help deliver our training content. And I'm hoping that many of you are familiar with the Quilts Institute curriculum. If you're not, we'll show our website here in a bit, and I encourage you to go take a look. The program that we have structured for apprentices is that they have an opportunity within their first 60 days of employment to take a pre and early service training program, training course. And so that basically gives them an overview, a lay of the land about how this particular field works, what is a DSP, what is my role. And then from that, they begin a kind of a 12-course sequence to really develop the full set of skill sets and competencies we would expect of a DSP. All of that is happening while they're also working 2,000 hours for you as the provider. So if you calculate 2,000 hours over, a year, it's really about full-time employment would lead in about a 1-year time to the full completion of the apprenticeship program. And so There's a lot of opportunities for them to be getting on-the-job training. They're getting this on-demand training from us. They're adding that with the on-the-job training that they get from you, and they're building in their competence. And that's why you see like the 91% retention rate. Go ahead. So if you thought you might be interested, Tom, if you thought you might be interested, I was realizing I was looking at my slide deck because I was having a hard time reading those slides. So sorry about that. If you think you might be interested in being a provider, here's what that means. There would be an orientation that we provide. It's on demand. So that orientation would get you the real basics about what do you need to do, what is the reporting that is required, how does the program work. Because it is a federally funded effort, and there's the opportunity for reimbursement of using federal funds, you have to comply with various EEOC and affirmative action provisions. So we would cover that material with you. There is an apprenticeship agreement that we have to file with the federal government. And once that apprentice gets recognized, then they can go ahead and start their coursework. There is a training fee. So our courses, as you know, are really equate to about 18 college credit hours. So this year-long project is really giving them substantive training. And so the cost to do the apprenticeship program is $840 per apprentice, but then there are funds available through the federal government that your completers, you can actually seek from your local workforce boards reimbursement of the monies that you've spent or a portion of that money. And depending really on where that employee comes from, how much money may be available for reimbursement. So that is kind of how it works. You would hire or identify one of your own employees right there in-house that you think might be interested in that. Once they get signed up, they begin both the on-the-job kind of training or mentorship. They also begin the digital or on-demand training. You are required to provide safety, a safe working environment, basic instructions about how to maintain safety. There is a wage progression scale, and by that, as they complete hours on the job and as they complete training components, there is a set progression that we would look for you to follow that really increases the pay wage of those that are in these particular roles. So it helps to get a more trained workforce, a more stable workforce, and then as they're developing skill sets, every 500 hours on the job, and for every 4 courses of the 12 that they complete, they're getting a wage progression. And all of that is spelled out in the various orientation documents as well. There is a coach, a person from our team that helps to encourage. Think of it as a success coach, somebody who's helping to encourage and folks to complete the training, somebody who's also helping answer any kind of questions that they might have. So your responsibility would just be able to make sure that we can get access to those learners, that we have a way in which we can talk with them as well. And talking with their supervisor can sometimes be helpful as we're trying to assess, do they in fact have those competencies at the end of the program. So wanted to just kind of clearly say that's what's expected of you as a provider. If this is something that you think you might be interested in, there is a website here on your screen, and I've also given you the contact information for our our director of operations for the Quilts Institute, Melissa Walker. I've given you her phone number. That happens to be her cell phone number, so be courteous and maybe don't call after 9. But I've given her cell phone number as well as her email address. You're welcome to reach out to her. If you'd like to learn more, we're happy to connect with you and get you more information. I said, we have here in this Middle Tennessee region one of the workforce boards is already committed to pay for the first 20 apprentices. And we're going to do these on a first come, first served basis. We already have a provider who stepped forward and has provided 5 workers they currently employ that they want to put through the apprenticeship program. So of the 20 seats, I've got 5 already taken, so 15 available. And we are looking for folks to get started in this work. We do have to have those folks in the program ready to start on November the 15th. So it's a Sunday, so technically, I guess, November the 16th. But just so you know, we're on a kind of we've got some funds left over from some COVID money. And so in order to spend that, I've got to have folks registered, those first 20 registered by November 15th. And then I would add that we're getting significant interest through the Tennessee job boards, people who are seeing and hearing about the DSP apprenticeship, and they have an interest in working in this field. And so if you would want to be one of those providers that we're connecting them with, also please let us know that. We'll make sure TENCO or whomever gets that notice so we can keep everybody informed when folks are coming forward. I think we had 50 folks last week who went online and said they'd be really interested in looking at careers as a DSP in this apprenticeship program. We'd like to connect them with those kinds of employment opportunities. So if you're interested, ask you to reach out to Melissa, make a phone call, try to grab some of those 20 seats so that we can really make a difference moving forward. So we just want to share that great opportunity with you. Tanya, do you have anything else you would want to add?
Yeah, just a couple of things. So actually, we had a provider who sent an email who said 5 more. So we only have 10 left now. So we've got 2 who have sent that. So just letting you guys know, please, if you are interested, please get in contact with them and get those names over. As Charlotte mentioned, there are also other ways that apprentices or potential apprentices are contacting us. They're contacting through Quilts, and they're also the Tennessee Talent Exchange. TENCO has signed up for on the Tennessee Talent Exchange as well. And so I know that TENCO has been getting that information out to providers on people who are interested. So just to say, there are a couple of different efforts that are going on, as I mentioned, around trying to help identify, not just for this apprenticeship, but trying to identify workers, period, who are good for the direct support profession work. We know this was quick. We are going to have another opportunity to speak with the TENCO providers in, I think, a week or so, but we wanted to get this opportunity out there with this funding so you all could reach out and try to get some of those current employees signed up. We will entertain any other opportunities that you want to hear about the apprenticeship as we move forward with the apprenticeship. Please, if you have questions that are maybe outside of the apprenticeship, please feel free to reach out to myself, and we will connect you all with as much information as we can. I know I saw some questions coming through on the chat that I couldn't see, and I'm not sure that we have time to answer, so we may just have to copy. Can you see them, Charlotte?
Let me jump in right here really quickly for you. Because there is actually another office hours that we have at 10:30, if we can just, if those comments with the contact information, if maybe those questions can be posed to our panelists via email, if that would help, because we do have to get off, and I know the TEIS folks, which I know many are still on, do have to get to another meeting.
And I think most people have my email address, but let me put it in the chat. Right.
And I've done the same thing with Melissa's.
Have that, Charlotte.
I was going to say, I did the same thing with Melissa's as well, so you can see that in the chat. And we will take those first 20 by timestamp, but please know that I was talking with somebody in another state has a similar, it's not a DSP, they have 6,500 people in their kind of home health aid program in their state for apprentices. So this is a great model to pull people into this field. We hope you'll engage with us. We believe that there is funding to help reimburse the costs, at least a large portion of that cost. So hope you'll engage with us in this process. Thanks so much for letting us be here.
Absolutely.
Awesome.
And Kyra, I see questions about the presentation. Are you able to share the presentation or with the group, or should we just email?
Yeah, if you can, since we have it, we will attach it to this week's edition of Open Line, and that way people can grab it there.
All right, perfect. Thank you so much.
Awesome. Great. Okay, we will call this a meeting. Thank you very much, Tanya and Charlotte, for joining us. I think that many people found it beneficial, and 2 weeks from now, we'll see you for office hours. Everyone else, bye.